Hi, Dr. Garima here again. Thank you so much for the beautiful comments for my previous ADC Part 1 written exam videos. Many people messaged me and emailed me asking me to make more videos regarding the questions and how they are for the exam. Guys, it takes a lot of time to prepare the questions and prepare as in even the questions that I had got for my exam to write it down and then explain about it. I'm trying my best to, fit it in my work schedule and everything. Though I have prepared good notes and all the study material on my emails to help you all read about it. Whenever somebody's emailing me, I'm trying to email them back, and it's nice motivation that you guys are giving. So let's go to a sample question. Sample question, as in this question was asked in my own exam, and it will be asked in every exam because this is one of the most important professional questions. Now, let me give you a history about this question. See, ADC people want to check your understanding of professionalism. So they have very smartly and trick wise created such questions which will make you think, and it will test as a professional how you're going to behave in front of a patient. So there are series of 5-6 questions like this in different formats. I'm going to tell you example of one such question, and a lot of debates were happening when such question was being discussed in our study groups when I was going to give the exam, and everybody had a different set of answer. And I personally felt the mentors who were guiding these people, or even the person who was guiding me, did not have a proper understanding of this. But later on, I studied more and I asked many people, and I understood the basic criteria of how to answer this question. So I'm sharing this very important question with you all. So let me read out the question. I think you can see it on the screen here. The question says, you informed a patient. So basically a patient came to you for a visit, and upon clinical examination you informed the patient that the endo treated tooth should get a crown treatment done within 1 year. Now the patient was very disappointed that the previous dentist did not mention this, and what to do like now. So the question is basically asking you that what would you advise the patient to do in such a scenario, because the patient is upset now and is looking for you for an advice. The patient is upset with the previous dentist that why did not the previous dentist ask them to get a crown done. Okay, now in exam 5 options are given. I'm going to give you more options because in your exam any one of these 5 questions, 5 options rather, would be presented to you. So you should have an understanding which option to choose in a hierarchy. Okay, so let's go to the first option, which is Inform APRAH. Second option is Inform ADA. Now both these are kind of governing bodies which I think act as a control of any negligence which is done by the dentist, but you will never complain to them. Okay, that is not professional at all, because first you are taking the patient's word that the dentist has not informed you. You are not even aware what was the situation there. Maybe the dentist has informed and maybe the patient is telling you otherwise. So you will never just call up these control bodies and are going to complain. This is so unprofessional. So you will not choose this option. Now remember, these questions are very important because they will always be marked, and on basis of such specific questions your pass or fail would be determined. Okay, so you have to perform these questions very correctly. Third option is ask patient to get the record from the previous dentist to be transferred to you with the patient's consent. Okay, now this option is correct in a way. So if your other options are all very unprofessional and this option is given, you would choose this option. Next option is ask your lawyer. This is also correct in a way again, but if you don't have any option which says that you can get the report from the previous dentist with the patient's consent, and all the options are like complain against this person or that person, you would choose this option, ask your lawyer. Now this is a very half vague option, like ask your lawyer about what basically are you going to ask him about. But this can be your answer of choice if the other options are absolutely unprofessional. Are you getting my point? The another option that can be given to you in the exam is tell the patient that you would call his previous dentist and demand an explanation. Now you have to read each and every word carefully, because there can be an option which says that you would tell the patient that you would call his previous dentist and request for an explanation. So if your option states that you will call the previous dentist and demand an explanation, it's very unprofessional and you will not choose this option. Imagine you are the dentist and a patient comes to you and you call his previous dentist demanding him for an explanation. It's going to sound very rude. Or if some other dentist calls you and demands an explanation, why you did not say so and so to the patient who was yours and now came to me. You don't know the whole story, how it was. So it's very unprofessional. So you will never demand an explanation from anyone. Another option can be call the previous dentist and tell him that a complaint is going to come his way. Now, who's putting the idea in the patient's head that you have to complain, So the other dentist is going to think like that why a complaint is coming my way, why you did not send the patient back to me or request me for an explanation. So this option is not to be chosen unless all the other options are very unprofessional. Okay, so this would be in the bottom list of your hierarchy to choose. Then tell the patient that you would call the previous dentist with patient's permission and request for a clarification. Now this is the best option. Now even if you have all the other options which tell you, which give you an idea that you can call the previous dentist and speak to him or get a clarity, the best option is always the option where you have the patient's permission and you're calling the previous dentist and requesting for a clarification, or you're getting the records transferred from the previous dentist with the patient's permission. These are always the best options to choose from if they are given to you in your exam. But exam questions are very tricky. They can give such an option and change a word, like demand an explanation or clarify. So read those options properly and just don't blindly choose. And the last option would be tell the patient to go back to the previous dentist and ask for the explanation. Many students that I had met during my exam told me that they chose this option because this was an option in the exam. But I wasn't convinced with this because, again, asking the patient to go back to the previous dentist and ask that dentist for an explanation is basically you're inciting the patient. Why don't you go back and ask for an explanation? You don't know what happened. So it's always best to give a call to your colleague and request for an explanation, because maybe that dentist has explained and maybe that dentist has written in the records that, we had suggested a crown but the patient refused to go for it. So you should never ask the patient blindly trusting the patient's words. You can always request in a polite way for an explanation from your colleague. The previous dentist, you always take them as your colleague. So again, choosing this option that you can ask the patient or rather incite the patient to go back and ask explanation from the previous dentist. When an option like this is given to you in the exam that you can request for a clarification, you should always choose request for a clarification or request for a record transfer, then the other options which suits. But you will never ever choose the option of complaining or demanding an explanation from the other dentist. Do you understand that? So this is a very important professional question and you will find different views of different study groups. Stick to the hierarchy and priority that I've told you. Okay? So I hope this was helpful as one question that I've explained. I have 5-6 other formats of the same question with different options which I've mentioned in my notes. If you want it, you can just email me on my email address which I've mentioned in the link below, and I'll give you my WhatsApp number over there where I can add you in the study groups that I've made. Currently around 20 participants are there in that group, and you will have study partners, as in you will see the questions that are coming through. So yeah, best of luck for your ADC exam. And I hope I can make more questions on certain important topics which will always be asked in any ADC exam. Those topics would be related to pregnancy, MRONJ, ANAG, and those lesions, the white and the red lesions in the mouth, and desquamative gingivitis. I intend to make such tricky questions as a video to help you to understand them better. So let's see how much time I get, but definitely I have mentioned such formats of questions in my notes which can help you so you can start reading them right away, because video takes time to prepare the slide, to edit it, to enter the slide in the video, you understand, and we all are working. So yeah, that about it. So I hope this has helped you, and leave your comment about it. Thank you so much.